Welcome to 2A's closure feedback presentation. Content warning: the following presentation will discuss a specific person's experience with domestic violence. This may be triggering to people watching the presentation who have had similar experiences. If this information is distressing for you, or if you need support in regard to domestic violence, you can call 1-800-RESPECT for 24/7 phone and online services. If you, a child, or another person are in immediate danger, please call 000. The importance of competence for physiotherapists in domestic violence. The main role of physiotherapists is to minimise harm for the client by offering services and help that they may not be aware of in order to help out the situation. Physiotherapists may be the first person or the first person to be made aware of the situation, and depending on how well we handle the disclosure of the domestic violence may depend on whether the patient seeks further support to remove themselves or anyone else from the dangerous situation. It is also important to be competent in order to maximise the physiotherapy outcomes. If a therapist is not competent in the situation and they do not alter their assessment and treatment to the scenario, then a client will not maintain their trust and they may become uncomfortable in the situation. Hence, less likely they will continue with the treatment. However, if a physiotherapist is competent and does adapt their practice for the situation, they will gain the respect and trust from the client, allowing them to greater influence and help the client through their domestic violence experience and disclosure. It is also important to be competent and know the legal requirements to avoid any legal action being taken against you at a later date. Physiotherapists should become competent by knowing laws and regulations and having strategies to manage the situations as they arise. It is important to be able to skillfully and respectfully help a patient through their experience, providing support without making decisions for the client. Physiotherapists should also have knowledge about the impact of domestic violence on their clients and their clients' families. How this may influence physiotherapy. As a result of Laura disclosing the domestic violence that she has experienced with her husband to us, it is now a pivotal part of our duty of care to provide support and advice. Ensuring that we are addressing the extra consideration with Laura and making sure she is in a safe environment and comfortable for us, the physiotherapist, to administer touch and massage techniques. By showing empathetic body language, Laura will open up and disclose the relevant information required for us to provide her with the best support given for her current situation. Also using strength-based questions to concentrate on activities she can still do to empower her to keep persisting with her kids. Also, after gaining consent for the treatment, ensuring that Laura understands that she has the power to cease the treatment at any point if she feels uncomfortable will allow for more confidence for Laura in us as the healthcare professional. There is an uncertainty of suggesting the use of crutches since we don't know how the husband will react to the situation, and it may inflict more harm on Laura as a result of domestic violence. Therefore, we may need to compromise and suggest a boot instead. Another essential aspect of the treatment of Laura as a physio is to stay updated on her situation, giving her the best care. Any progress of domestic violence after the appointment, education on helplines, chasing up on possible helplines if she hasn't done so, or if she isn't confident to do so, and possibly extending her appointment slightly to extending her appointment account time to allow for a chat at the beginning of the appointment.
It is important for a physiotherapist to implement strategies to effectively develop a trusting and therapeutic relationship, as well as help patients navigate their way to find professional help. Physiotherapist Anita Bohr outlines key strategies that she uses in situations of domestic violence. It is important to create an environment of respect and trust, allowing the patient to feel comfortable. This is achieved through active listening and being professional and warm in our communication. It is also imperative that you acknowledge the situation and do not dismiss it. Respectfully explore the patient's personal experience, showing empathy and appreciation for them having the courage to speak out about their situation. You could say, "Thank you for telling me. I could imagine how hard it would have been for you." You should also outline your role as a physiotherapist, stating that you will have to document this. However, it is confidential and will not leave the room. You should ask if they've told anybody else or if they've thought about speaking to any health services. Finally, then continue with your treatment. With any manual handling treatments or assessments, outline to the patient what you're doing and why it's important. Give them the option to say yes or no, as well as the option to stop if they're uncomfortable. It's important to give the patient the power and also to constantly regain consent. As we have learned in the previous learning issues, health practitioners are not obligated to be involved in any legal aid and are advised to avoid being involved. Therefore, physiotherapists are not required to report any disclosure of DV that they've received. However, it is required that practitioner document any injuries and information provided to them about the domestic violence situation. The practitioner should document any statements revolving the DV in order to be legally supported from a professional view, as well as providing evidence if or when the DV is officially reported. Despite not being obligated to report or be involved in the patient's claim of domestic violence, we have the ability as health professionals to be empathetic with our patients and offer support services. We don't have the right to tell a patient what they should and shouldn't do about their circumstances with domestic violence. However, we can be supportive and offer options that could help with their situation. It is required of the therapist that all information the patient discloses is kept confidential and isn't reported to outside individuals or services without the consent of the patient. Now, there are a few things that we can do or learn in relation to domestic violence. We should look into what legal work may be necessary when addressing a case involving domestic violence, how to recognise signs and injuries of domestic abuse towards a client, both psychological and physical, how to handle your own mental health when dealing with such cases, how to deal with domestic violence across different cultures. For example, in some cultures, it may be seen normal for a partner to be physically abused, and this may impact their ability to deal with other injuries you're responsible for treating. We should also look into how the situation differs if children are being involved. Look, for example, if the children are also being abused. Scenario specific, you suspect the patient's life may be at risk. How are you as a therapist meant to follow their request to not document what has been revealed? And what to do if a previous client of yours and victim of domestic violence has recently stopped coming back to the clinic? These are a couple of things that should be thought about and reflected upon. Here are the following references that we have used throughout our research and presentation. Thank you for listening.